Good morning everyone, and welcome to our first ever online HR Breakfast Club webinar. We would normally be welcoming you into our offices this morning, but obviously due to the circumstances we're hosting this webinar online. A few of our regulars have actually asked me over email whether their bacon butty is going to be delivered to their door. Unfortunately, that's not going to happen. So if that's a deal breaker, you've still got time to leave before we start the content. What we do have for you this morning is lots of advice and insight. So I'll let you decide what you value the most. For anyone that doesn't know me, my name is Sarah Glynn and I'm marketing manager for Kuits. We are an award-winning commercial law firm based in Manchester city centre. Subject of the webinar this morning is obviously getting everyone back to work safely, and I'll be taking you through the agenda in just a moment. Just before we get on to that, just very briefly wanted to mention all of the other ways that we've been helping our clients through these difficult times. So in addition to advising clients on their HR issues, furlough and getting their workforce back to work. We've also been looking at property and commercial contracts for clients and able to kind of make key introductions to short-term finance businesses as well. So I won't go through that in any great detail, but it's enough to say if you have got any other issues, wider issues that your business is facing at the minute because of COVID, please do get in touch with us and we can point you in the right direction. So very pleased to introduce your speakers this morning. We have Sally and Mark, who I'm sure are familiar faces for some of you, regularly present at our in-person HR Breakfast Club events. So you can give us a wave, Sally and Mark, if you like. So both partners in our employment team. We're also very pleased to welcome David Collins, who is founder of Collins Consult and a health and safety expert. This is David's, I think, second appearance in a HR Breakfast Club webinar. So he's back by popular demand, so no pressure, David. So David's going to be taking us through some of the work he's currently doing with clients, including risk assessments in line with government guidelines around people coming back into the office safely. But also taking us through some health and safety tips as well for those of you that have remote workers in your businesses still as well. So the agenda this morning, I'm just going to be going through some housekeeping and ways to connect with us following the webinar. We're then going to move on to looking at the job retention scheme and the latest position with that scheme. That includes any updates to flexible working and return to work. We're then obviously going to be coming to David, who's going to be touching on the issues that I've just described. And then we're going to go over to Mark, who's going to be taking us through managing the return of employees to work. Including where you might be getting some resistance for employees and what to do in that situation. And then we're going to hand it over to you for some Q&A at the end, and I'm sure there'll be lots of questions there, so we'll leave some time at the end for that. So lots of different ways to connect with us. We are on Twitter and LinkedIn. We share insights multiple times daily across all areas of issues surrounding COVID and other legal issues. So please do follow us on those social media channels if you don't already. And I'll be giving you some details in a second about how you can sign up to our mailing list as well. So just a couple of bits of housekeeping from me before we kick off. Like I say, many of you probably will have questions. You're all at different stages of your return to work projects. To ask a question, if you go down to the bottom of your screen, there is a little icon called Q&A. If you click on there, you'll be able to ask us a question, which we'll come to at the end. You can ask that question anonymously. Obviously, we know some of these issues are quite sensitive for businesses, so there's no need to put your name or your business name, and you can ask that question completely anonymously. It is worth pointing out as well that this webinar is being recorded. So again, just to give people a little bit more confidence around asking questions, you don't have to put your name. If someone's asked a question that's very similar to yours, you can also upvote by clicking the thumbs up button. So we know that there's a couple of people who want to ask a similar question there. And then following today's webinar, we are going to be sending a follow-up email. It will include all of the contact details of the speakers, so you don't have to worry about getting those down as we're watching. We'll also be giving you some details of a fixed fee package, which I know Sally's going to come on to a bit later, so I won't tell you too much about that. We're also going to be sending you a post-event survey, which we would be really, really pleased if you could fill in for us, just to give us some feedback on today. Let us know other topics that you might want us to consider for future webinars that will help you the most. And then also normally, obviously, if we're hosting an in-person event at our offices for the HR breakfast clubs, we would also be hosting a networking session beforehand. We just want to know if that's something that you would find useful, perhaps speaking to other HR managers in similar businesses to you and how they're handling these times. So we will be asking a question as part of that survey, who would like to possibly be involved in something like that if we ran it a little bit later in the month. So without further ado, I will hand over to Sally Bird from our employment team, who's going to be talking about the job retention scheme.
Thank you, Sarah. Good morning, everyone, wherever you are. Yes, so I'm going to be giving you an update on the furlough scheme, as it's more commonly known. We're now into the final furlough of the furlough scheme, pardon the pun. It's been in place since March. Originally, it was in place until the end of May, and that was then extended, and now it's ultimately been extended until the end, until the 31st of October. So that's a period of 8 months, which I think is far longer than anybody expected it to last for. So I'm able to give you an overview based on the Treasury direction that came out late last week. Do please note, though, that more detailed guidance is going to be published on the 12th of June, and that will tell us much more about some of the finer details, but certainly I'm able to give you an overview today. So if we move on to the first slide. So impact of the scheme so far, it's used by 1 million employers and 8.4 million employees have been furloughed. The cost of the scheme is eye-watering. So far, 15 billion, estimated to be over 45 billion. So that will cost more than the NHS. So not surprising that it needs to be wound down for the sake of the public finances, but also to get the economy moving again. It's been heralded as a success. It's one of the most generous schemes on offer in most of the G7 economies. Now, the aim of the scheme at the outset was to allow businesses to put jobs on standby, a bit like a temporary layoff situation, but with some guarantees over pay, and that was to discourage mass redundancies. Now, what we know in practice is that it's been used far more widely, not just where work is not available for employees, but also to cover situations where employees can't return to work. So if they're shielding or if they have childcare difficulties because of the closure of schools, furlough has been a solution, and that's something that the government recognises. So for those who are on furlough, there should be letters or furlough agreements in place, and employers will obviously have made the decision as to whether they are limiting what they pay to the amount that they're able to recover from the scheme, or whether they're continuing to maintain full salary, which I'll refer to as topping up. So one of the key changes is the introduction of flexible furloughing. So when this was first introduced, what was clear from the outset was that it was a very strict position, that an employee cannot undertake any work or provide any service that generated revenue for the employer whilst on furlough. And that's one of the areas where the greatest abuse of the scheme is suspected. So even if an employee was working short time under a contractual provision or reduced hours, that would rule out any claim. Now that's all changing. So from the 1st of July, employers are able to bring back employees part-time and still be able to claim the grant for any of the employees' normal hours that they don't work. What we know is that employees can work as much or as little as is required. The suggestion is that somebody on a 40-hour week could work for 1 hour and be furloughed for 39 hours. Now, the guidance will make that clear, but it doesn't seem that there's going to be any limit. When claiming the grant, you need to claim for a minimum period of 1 week, but you can still claim for longer periods of 2 weeks or 1 month if that's what you've been doing already. What the note says is that employers must agree with their employee any new flexible furloughing arrangements and confirm them in writing. So that's an important requirement. They would claim the grant, continue to claim the grant for any normal hours that are not worked. And then the obvious point is that employers do need to pay employees directly for the hours that they do work. So we'll look to the further guidance on the 12th of June in relation to that, but those are the headline points. One of the points that creates, I think, the most pressing need for action is the fact that the scheme is going to close to new entrants from the 30th of June. So the direction says that employers can only furlough employees that have been furloughed for the full 3-week period prior to the 30th of June. That's slightly misleading. What this really means is that the final date that an employer can furlough an employee for the first time is next Wednesday, the 10th of June. So if employees have been furloughed previously, going back to March, they can be furloughed again in the future. This is just putting somebody onto furlough who hasn't been on furlough before. Because there's a requirement for them to have been on furlough for 3 weeks up to the 30th of June, we count back and we get to next Wednesday, the 10th of June. So this turns the focus onto planning. This scheme will last for almost another 5 months. So employers have to think very carefully and very quickly about whether any of their workforce may need to be furloughed in the future. Now, lockdown is easing and the focus is on getting people back to work, of course, but we don't know whether the infection rate will rise. There's talk of local lockdowns. So if that were to happen, if you're then left unable to furlough a worker because they haven't been furloughed before, that could be a difficulty. So the question mark is whether, if in doubt, you should place somebody on furlough in June, even if you then bring them back or bring them back on a part-time basis, just so you've then preserved that right to furlough them in the period from July to the end of October. So employer costs. So everything remains as it is for June and for July. The changes start to kick in upon an enhanced employer contribution from August. Now, obviously, from the 1st of July, if any employees work part-time, then they have to be paid for those hours by the employer. The change from the 1st of August is that employers have to pay employer national insurance contributions, and they have to cover the auto-enrolment basic pension contributions for the hours that the employee doesn't work. Now, according to the government statistics, of all the claims made, 40% of employers have not even bothered to claim for those two elements anyway. So the government doesn't see that this is going to have a huge impact. However, from the 1st of September, that's when the level of the cover will reduce. So from the 1st of September, it will come down to 70% of wages up to a cap of £2,187.50. Plus, employers pay national insurance contributions and pension contributions. And the direction says that they must then top up wages by 10% to make it back up to the 80%. From the 1st of October, that goes down from 70 to 60%, which is £1,875. Again, the expectation is that the employer tops up the 20% as well as the national insurance and the pension contributions. Now, the government have also published that the average value of a claim under the furlough scheme is for the sum of £1,380 per month. So using that figure, in August, the cost to an employer will rise by £69, but it then jumps up quite considerably to £207 and £345. So in percentage terms, percentage of employment costs, you're going from 0 to an additional 23% cost within October. October is then the cliff edge where no further support is going to be available. So, as before, employers need to decide what they're going to do. If they're already topping up salaries, are they going to continue to do that all the way through to the end of October? And if they do, clearly the amount they can recover is going to taper downwards. An immediate question is whether those employers who have agreed with their employees that they will just be paid what the employer can recover on the grant, will they be able to similarly agree with employees, well, we'll only pay you 60% or we'll only pay you 70%? I'm hoping the guidance will answer this definitively, but the strong indication is no, you're not going to be able to do that. From August, you are going to have to pay that 10% and pay that extra 20% to make it up to the 80%. I don't think any deviation from that is going to be possible. So looking at the issues for consideration, the big question is, of course, whether this escalation of employment costs is going to tip employers over the edge and into redundancies. The immediate points are that employers need to review their existing furlough agreements or furlough letters, which were probably sent when the expectation was that the scheme would end at the end of June or the end of July. So these are probably likely to need updating to cover the post-July period, and also to cover any flexible furloughing that's intended. For those employers who are topping up, they need to decide, are they going to continue to top up until the end of October? Or alternatively, are they now going to say to their employees, we can't afford to do that, so therefore we need you to accept and agree to a reduction to 80%. Now, it was thought that there might be some extension of the scheme by sector, but that isn't the case. This is a kind of one-size-fits-all approach. But for those sectors that are hit the hardest, and hospitality is at the forefront of that, many think that there's still going to be a likelihood for those businesses to consider redundancies and to plan accordingly. So at the individual level, obviously, you're mindful of carrying out redundancies fairly, so fair selection, consultation. Those with more than 2 years will have unfair dismissal protection. But we also need to be mindful of the minimum consultation periods if we are into a situation of collective consultation. And those employees with less than 2 years service will still count towards numbers, which quite a few people don't always appreciate. So if you are intending to make redundancies at one establishment within a period of 90 days or less, then there are minimum consultation periods which apply. If it's 20 to 99 employees, that period is 30 days. If it's 100 or more, it's 100 days. And there's also a duty to notify the relevant government department, the Secretary of State, that used to be called for Business and Industry. So looking at these new timescales within the furlough scheme, if redundancies are intended to take effect on the 1st of August, when employer costs start to kick in and increase, then if a business was looking at 20 to 99 redundancies, then they would need to start the consultation process before the 1st of July. If redundancies are intended to take effect when the scheme ends at the end of October, they would need to start by the 30th of September. If it's more drastic and 100 or more employees are likely to be made redundant, then the start date, if the redundancy takes effect on the 1st of August, would be as early as the 16th of June. If when the scheme ends, the 15th of September. So many HR professionals won't have embarked on collective redundancies, perhaps since the financial crash, but there are complex procedures involved. There are lots of technicalities, and there have been a number of case law developments. So there's a number of areas that employers can trip up on. So this is why Kuits are offering a bespoke product in conjunction with insurers, which enables us to provide a fixed cost solution to help businesses through redundancy programs. So for a fixed cost, you could receive advice and all the documentation needed to support a redundancy process. And that would be underpinned by insurance cover against any claims, including any claims for protective awards. So if that's of interest to anybody, we'd be delighted to provide further details. Okay, thank you. I'll hand over to David Collins for the health and safety aspect.
Thank you, Sally. Good morning, everyone. Next slide, please, Sarah. Okay, so I'm going to talk a little bit today about the practical aspects of returning to work from a health and safety perspective. I'm just going to quickly touch on the legal framework around the guidance that the HSC and the government have published so far. It's worth noting that there is a number of issues with the guidance today, certainly since the middle of March, because this is such a fast-moving pandemic and information's becoming available all the time. You'll recently note that anosmia was a list of new symptoms added not too long ago, 8-9 weeks into the pandemic. So in terms of the HSE guidance that's available, it's available on the government website. It's sector specific and covers 8 sectors. It is guidance. It doesn't have any real status in law, but the underpinning law for health and safety is the good old Health and Safety at Work Act that's been with us for nearly half a century now. And the duty is to ensure, so far as reasonably practicable, the health, safety and welfare at work of all your employees. So this includes protecting employees against the risks associated with COVID-19 and the coronavirus. So in terms of the guidance, I know, well, I've mentioned England, there is guidance within Scotland, and that's not as detailed yet, and they're looking at their phase 1 of easing lockdown, and note that they are still in lockdown across Scotland and in Wales. And their guidance, whilst not as detailed as the English guidance, does go further in some respects, such as travel to work and childcare arrangements. But what I would say is when you come to do your risk assessments for return to work or to review your risk assessments if you're back at work, is to just make sure you check out the relevant government portal to make sure you've got the most up-to-date guidance. Next slide, please, Sarah. So what is reasonably practicable when doing your risk assessments will depend on your particular case, your workplace. Obviously, workplaces are different across all the sectors: construction sites, restaurants, office environments, manufacturing, and warehouses. And when you're doing your risk assessment, the large issue around it is subjectivity. When you're looking at it and applying the guidance, are the measures that you're thinking about going to be readily acceptable by employees who may have a view on the measures that you're putting in place? I know Mark's going to talk a little bit more about employees that don't want to come back in the next section. If you're following the guidance and there's a certain section of the guidance that you can't follow, then it's very important that you record the reasons why and justify why you're taking the approach that you are taking in your risk assessment. When you've put your risk assessment in place, it's extremely vital that you follow it, because this will stave off any potential future regulatory enforcement from HSE. And when I say HSE, I'm talking about all the other regulators, such as the local authorities and CQC as well, who may enforce against the guidance and the legal requirements. So the basis for risk assessments is under the Management of Health and Safety at Work Regulations 1999, and it's actually Regulation 3 if you're interested. But what it requires you to do is identify what could cause injury or illness in your business or workplace, so looking at the hazards. Decide how likely it is that someone could be harmed and how seriously they could be harmed, so that's the risk analysis, and then taking action to eliminate those hazards, or if this isn't possible, then control the risk through a series of control measures. So when we're talking about COVID-19, obviously you can't eliminate the hazard currently of spreading the virus, so the controlling the risk part is your hygiene procedures, your social distancing, and all of those elements that you would put in place. It's also worth noting that there's no specific template to record your risk assessment. So as long as it records the harm, the hazard, the existing control measures and future control measures, and there's an analysis of how low, medium or high the risk is, then that will suffice. So your current risk assessment template will be sufficient. Next slide, please, Sarah. So I mentioned before, there's 8 sector-specific pieces of guidance currently in England, and they cover construction and outdoor work, factories, plants and warehouses, labs and research facilities, offices and contact centres, other people's homes. So for example, if you're a tradesperson, so you've got tradespeople working for you, or you're in the care sector, restaurants offering takeaway or delivery, shops and branches and vehicles. Now, there will be more guidance launched as lockdown eases. So, for example, when restaurants and bars are able to come back to life, hopefully in the near future. The retail and manufacturing guidance that published in Scotland differs slightly to the Westminster published version, as I mentioned earlier. However, I trawled through the Scottish Government web pages this morning. There's other guidance now being published as well, but as I say, it's not as well developed, and it is a first stage in planning to ease the lockdown. Now, the guidance documents were launched on the 11th of May and came into effect on the 13th of May, and they were revised as they've been introduced into the certain sectors, and industry feedback has come through to the government and the HSE, and various pieces of guidance have been revised. So the shops version, shops and branches version, was revised on the 25th of May. So anyone that would have done a risk assessment back on the 11th or 12th of May when the guidance was launched would have had to then review the guidance and then look at their risk assessment and do a review again only 14 days later. So next slide, please, Sarah. So on the government website with the 8 sector-specific pieces of guidance, there's also a helpful guidance called 5 Steps to Working Safely. And this guidance is quite useful because it breaks down the other pieces of sector-specific guidance into bite-sized chunks. The guidances themselves follow a very similar format. So if you're fortunate enough to have some time on your hands and read all 8, you'll see that they follow a very similar pattern, and they're like a checklist of the things that you should consider. As I said before, is check the pages regularly on the government websites to make sure you're using the most up-to-date guidance. So when we're talking about reopening and return to work and ease of the lockdown, now that the government is saying that the R number is below 1, the reopening is about controlling the risk of the spread of the virus. So before starting work, so if you haven't gone back, do your risk assessments well in advance. And as part of that process, and often overlooked, is look at your facilities management aspects. So if your business has been shut down for some time, you may need to consider your Legionella risks, so water that's been standing in taps and shower heads for some time, and you might need to do a flushing programme. Your fire safety measures, so if you've been shut down since the start of the pandemic, then that's nearly 2.5 months. So your fire alarms, are they still working? Emergency lighting and fire extinguishers, are they still in place? Ventilation systems. One of the things we're going to talk about very shortly is touch points. So you might want to set your ventilation systems to a comfortable temperature so people aren't touching the keypad, and reducing one of those contact points that would then need to be cleaned frequently. And then statutory inspections. During the pandemic, statutory inspections must still have had to be completed. So if you've got a lift in your building, for example, and it required its 6 monthly certificate of thorough examination inspection, that would still need to be done, as well as things like fire alarm testing, statutory gas safety inspections, etc. Then before you return to work, once you've got your risk assessment in a way that you think that's going to be a feasible operating scenario, then consult with your workers and any trade unions that you're involved with, and they will be able to give you any tips or advice. And as I said before, with workers, the control measures you put in, they may be sufficiently worried about coming back to the workplace. So consult with them is going to be very important to take on board their views. Once the risk assessment is ready to go, then share the results with the workforce. If you're a larger organisation with more than 50 employees, then you need to display your risk assessment on your website. That is one of the regulatory expectations. And then also display the COVID-19 secure charter within your workplace or each location. Now, this can be found within each piece of sector guidance, and it's a simple A4 page that the organisation would sign to say that you're COVID secure. Next page, please, Sarah. So when we're doing our risk assessments, as I said, it's subjective, but there's some key questions that you should ask yourself. Can the business maintain social distancing at all times, and how can it be enforced? So if you've got a tight workplace or a small office or small business, then that could be quite difficult. For larger premises, it's looking at things like bottlenecks. So where does aisles or corridors become narrow? Look at staircases and certainly corridors along each of the floors. How wide are they? Can people pass safely? Do you need to rearrange any of your workstations? Can you get your desks or tables or workstations 2 meters apart? If you can't, you may need to consider screens or barriers. Do you need to reduce the number of employees at any one time? So split shifts, putting shift patterns in place, staggered start and finish times to reduce congestion, could all be things that you can consider. How are you going to ensure that you've got a good cleaning regime during the day and at the end of the day? So obviously the spread of the virus is through droplets that you secrete from your respiratory function. So these settle on surfaces, and the latest research shows that on cardboard it can last up to the virus can last up to 24 hours, and on plastics and steel up to 72 hours. So if someone does cough during the day just normally and the secreted droplets land on a surface, how are you going to deal with keeping those areas clean so someone doesn't come and touch that and then touch the face and potentially become infected with the virus? Will the business inquire into employees' health or the health of their households? So again, everything we've learned to date is all about if you display symptoms, you must self-isolate for 7 days. If someone in your household is displaying symptoms, you must self-isolate for 14 days. But what we also know is that there's a lot of people that may be asymptomatic, so carrying the virus without showing symptoms. So some sort of assessment, a daily declaration that people haven't got symptoms or anyone in the household could be a useful tool. And also doing assessments of people who may be at higher risk, for example, the clinically vulnerable or the extremely clinically vulnerable. And the topic this week's obviously been of those sectors of society that are more susceptible to the virus as well. So looking at the latest thoughts around that and building that into your assessment process. Then how are you going to do common areas? So kitchens, restrooms, to ensure social distancing is maintained. I'm going to come on to that in a little bit more detail on the next slide. But it's quite interesting that the approach that some of my clients have taken, and I'll talk through some of those scenarios. And how will the business communicate the changes to its employees? So not only when you do your risk assessment should that be the last time that you contact them, but frequently update them on the measures that you're taking, the guidance that's coming out, and anything that affects them being safe at work. So next slide, please, Sarah. So we mentioned before about cleaning schedules. So cleaning, hand washing and hygiene. So again, these are well-trodden and publicised control measures. So encouraging people to follow the guidance on hand washing and hygiene. So wash your hands for 20 seconds under hot running water with soap. That is the best way of stopping the spread of the virus. Now, where we can't have hand washing facilities, for example, you're not going to have a sink as you go through your entrance door where you've got a touch point or a contact point, then provide hand sanitizers around the workplace. So on some of the assessments that we've been doing, we've been putting hand sanitizers on the journey through the building to the place of reception, signing in or work. So that could be through the main front door and then through the double doors. So if people sanitize their hands as they touch the contact point, then theoretically they're not transferring anything if they've just sanitized. And frequent cleaning and disinfecting of objects and services that are touched on a regular basis. So an example of that is if you've got door entry systems that are fingerprint scanned, or you have fobs, or you have visitors buttons that visitors need to press. So if you have to clean these areas quite a lot because people have touched them, that could be quite intense and very difficult to achieve. So what I would say is that look at your contact points and try and reduce them as much as you can by putting other measures in. So for example, if visitors come to site, cover over your visitors button and put a mobile phone number on there that they can call from their own mobile phone. Doing the assessments that I've done on one in a warehouse, it took 6 hours reviewing the contact points. As you can imagine, there will be quite a lot. And coming up with measures to reduce them as far as practicable was a challenge. So take some time to walk through and look at reasonably where people would touch. Enhance cleaning procedures for busy areas and make sure that you have clear guidance on cleaning for the whole workplace. If you've got handrails on staircases, for example, because people need to use them, door handles is one, and also for toilets, that's the main one. So you've got flushes, you've got handles, you've got sinks, taps. Again, you need to set clear guidance and rules on how you're going to use your toilets. Provide hand drying facilities, either paper towels or electrical dryers. Obviously, you will have them anyway, but we're finding that paper towels are being a bit more effective than some of the electrical dryers, especially the ones with a touch point. So the key issue is reviewing your contact points, how you can reduce them, how you're going to manage them and how they're going to be cleaned. And also don't forget your kitchens, such as kettles, microwaves and refrigerators. And then for like restaurant establishments, menus or anywhere where you give out a brochure, how are you going to limit them? How are you going to maybe distribute them safely or move them online virtually. So with kitchens, on a lot of sites that I've visited, we've shut down the kitchen facilities because that's going to be a breeding ground because of the touch points, such as kettles, refrigerators and microwaves, and instructing people to bring in pre-prepared meals for lunch, not to leave the premises during the working day, and also bringing in flasks with their own coffee and also drinking water and water bottles. Again, if you have water fountains in the workplace, it's another touch point that can easily be managed by people cooperating and bringing their own things in. Don't forget work equipment as well, hand scanners in retail environments, IT equipment, etc. Next slide, please, Sarah. So we've all heard of social distancing, and we all should be aware that where possible, we should maintain 2 meters between people by putting signs up to remind workers and visitors of social distancing. Now, what I find, and a little bit later on this slide, you'll see, beware of social distancing fatigue. I went to a well-known wholesaler last night, and it felt like there was no pandemic, and there was more signage than I've seen in any workplace, and yet people were just ignoring the whole idea of social distancing, as if the pandemic was over. Patience is key. So when you're doing your social distancing review, if you've got bottlenecks, is stand and just watch how people work, how they circulate. Obviously, if you've got staggered shifts, that reduces the number of people that potentially could circulate in the workplace. But it is about working and about telling people to be patient. I hear the phrase, this is the new normal, quite often now. And it's about when someone's in an area that you want to get to, then wait for them to exit it if you can't maintain social distancing. Avoid sharing workstations, so no hot desking, and use floor tape or paint marks on the floor to help people keep 2 meters distance. So you would have seen this in a lot of the supermarkets, especially queuing at tills or queuing to go in the door. It can be similar within the workplace. And also, if you've got bottlenecks, try and arrange for one-way traffic, so people are 2 meters behind each other, and that will reduce crossing points. Switch to see visitors by appointment only, or not at all, would be better, so you're reducing the amount of people coming into the workplace. Access to premises, so arrival times, entry, end of day. So if everyone arrives at 9 AM and parks in the car park, you're going to have a lot of people trying to access. So stagger those start times and give people a time to enter the premises. But if you do turn up, or any of your employees or colleagues turn up at work and people are trying to get in, again, it's just about waiting and being patient. Think about your delivery protocols. So a lot of people are not asking to sign for packages now. A lot of the drivers, they'll just drop them on your doorstep. It's the same when you get back into work. Look at how you can social distance, how you can make sure that you don't come into contact with a driver. And also, if they ask for access to your welfare, you must grant it. It is a legal requirement. And then toilet entry is one that we're often asked about. How can we let people know that someone in the toilet, if you put a one person in the toilet process in? Well, one of the easiest ones I found is to put a bucket on the floor outside the toilet door that you slide in front of the door. Again, you're touching it with your foot. It reduces a contact point of putting a sign on the door that someone may need to turn over. And no making brews for your colleagues, because obviously you're going to be touching, cups, etc. So next slide, please, Sarah. So where it's not possible to keep 2 meters apart, consider whether an activity needs to continue for the business to operate. Keep the activity time involved as short as possible. You could use screen or barriers. If you have to work within the 2 meters, consider back-to-back or side-to-side working. Stagger your arrival and departure times. Consider shift or split team working, and reduce the number of people each person has contact with by using fixed teams or partnering. And one of the ways we've done that in one of my clients, they have a husband and wife, and they've made a good team because they reside together and travel together. So next slide, please, Sarah. So just going to touch on working from home. So that is still the government's approach and guidance. And I think this is an easy one for the government. because anyone that's been working from home now since mid-March has probably found it successful to do so with the virtual tools, webinars, Zoom and Teams, etc. So what you should do as an employer is take all reasonable steps to help people to work from home by discussing their home working arrangements, making sure they have the right equipment, and that they have access to remote systems so they can work. So things like Citrix, etc. Teams is a good one. Including them in all necessary communications, because this will help with their physical and mental well-being of not feeling isolated. And there's no need to visit someone's home to do a risk assessment because that will be too intrusive. Next slide, please, Sarah. PPE is a number of questions we normally get on PPE as well. So HSE's expectation is that proper face masks are only required in healthcare settings. If you do not normally need to have respiratory protective equipment in your workplace for any of your activities, then you do not need to start issuing them to staff. You're not going to get infected if you don't normally have to wear RPE because of your job. There's no evidence currently that using a face mask outside of a healthcare or clinical setting will protect people from coronavirus. However, face coverings, if people want to wear them, then as an employee, you should support them, but always remember that any PPE and RPE is a last resort. Next slide, please, Sarah. I'm just going to touch a little bit on enforcement. So HSE will be enforcing or the local authority, and they've indicated they will take a pragmatic and proportionate approach to enforcement. So if it's a first visit to a workplace, then it will be advice and guidance about social distancing and hygiene measures. But if multiple visits are conducted, then improvements and prohibition notices or even prosecution could follow. It's worth noting that within the guidance, there's a contact number and a web form that people can report employers that are not following the guidance. And the latest reported number is in excess of 5,000 workplace concerns raised since March to the HSE. So this is indicated to the government that more support was needed. So HSE have been given an extra £14 million, equivalent to 10% of their annual budget, to get more call centre employees, inspectors and equipment during the easing of the lockdown. Next slide, please, Sarah. So duty to report, RIDDOR. You may have seen this, that COVID-19 infection in the workplace is a RIDDOR reportable offence. However, we think this is just going to be mainly in the healthcare settings, as it's going to be more difficult to prove in a non-healthcare setting. The whole thing around RIDDOR is you need to be able to prove that the virus was contracted within the workplace. So if people are not working with people with the virus, such as a hospital or a care home, then people could caught at the shops or on the way in on the bus. So again, it will be unlikely, but however, if you do need to report them as a RIDDOR offence, if you feel as though someone was affected in the workplace, then make sure you do report it under RIDDOR. But again, it's all about your control measures. If your control measures are suitable and would mitigate against them contracting the virus, then you may not need to report it. But again, RIDDOR at the best of times is a grey area anyway. Next slide, please, Sarah. Okay, that was me. So I'm going to hand over to Mark, who's going to talk you through employees who may not want to return to the workplace. Thank you.
Thank you, David. Morning, and hope everyone is keeping safe and well out there. So I'm going to be looking at an employee refusing to return to work. Of course, this applies simply to those that can't work at home. The government guidance remains that those that can work at home should stay at home and should not travel into the workplace. Rather ironically, I'm sitting here in the workplace speaking to everyone out there. So I'm going to look specifically at two reasons that employees are relying on for refusing to come in. Health and safety and lack of childcare provisions. David has talked about the legal obligation placed on employers to provide a safe system of work. In equal measure, there is an implied term in all contracts of employment that employees comply with any reasonable management instructions of their employer, which could mean coming into work. So, starting with health and safety, two pieces of legislation to consider. And interestingly, this legislation is over 20 years old, so it wasn't designed with COVID-19 in place. So what we're trying to do is interpret what the existing law is to the present circumstances. And to some extent, employers are asked to be pragmatic where they can and to support their employees. So the first piece of legislation, sections 44 and 100 of the Employment Rights Act 1996. So section 44, and I've paraphrased this, it says that where an employee reasonably believed that there was a serious and imminent danger, they obtain protection against an employer imposing a detriment or being dismissed for not returning to work. Now, what is a serious and imminent danger? It's likely that COVID-19 will be a serious and imminent danger because it has resulted in deaths. So part of the battleground with resisting an instruction to return to work on grounds of health and safety is around what is a reasonable belief. So it is fact dependent, depends on the individual's personal circumstances. So an obvious case would be where an employee is shielding or shares a household with somebody who's shielding, then it would be unlawful to ask them to return to work if they can't work from home. At the other end of the spectrum, you may have an employee who is in their early 20s, no underlying medical condition, and maybe simply anxious about returning to work. Now, you could argue they're not in that high risk category, so they don't hold a reasonable belief that they're under serious and imminent danger. Equally, employers will need to consider things like geography. This week, it's been reported that the north of England has twice the rate of infection than London, as it stands at the moment. Where we are in the alert system, the government's 5-level alert system, we're currently at level 4. If that goes up or comes down, then employers will need to consider that. And another interesting piece of research that came out this week in relation to inequalities within COVID-19 deaths, and it was a publication by Public Health England. This came out on Tuesday, so unfortunately it was after I prepared the slides, but I will circulate the link afterwards. And so that talked about disparities in the risks and outcomes of COVID-19 deaths. I'm just going to pick up on some of the key points, which I think is relevant within an employer's consideration of the reasonable belief that employees may hold. So that said that the largest disparity was age. So those aged 80 and above were 70 times more likely to die from COVID-19 than those under 40. The risk of dying is higher in males in deprived areas. It's also higher in those in Black, Asian and minority, so BAME groups, than white ethnic groups. People of a Bangladeshi ethnicity are also have twice the risk of deaths, twice the risk of dying through COVID-19 than white British ethnicity. And also, it was rather interesting, the report said that among the deaths of COVID-19, there's a higher percentage mentioned diabetes. In fact, it was 21% of cases. Also hypertensive diseases, so in other words, high blood pressure, chronic kidney disease, chronic obstructive pulmonary disease, and dementia. So an employer should weigh up the individual circumstances facing the employee. Is the employer required to pay the employee? Well, the general rule is that the employee must be fit and able to return to work. If they are and they simply refuse unreasonably, then the employer is entitled to say, I'm not going to pay you. For any employees that are shielding, there is still the possibility of furlough. As Sally said, that's due to run out shortly. Any new entrants to the furlough scheme should be placed on that before the 10th of June. In terms of a tribunal claim, employees can bring claims under Section 100 if they have suffered a detriment. So, for example, they haven't been paid despite holding a reasonable belief that they were under serious and imminent danger, or they were dismissed. They can bring a tribunal claim. Any dismissal would be automatically unfair in circumstances where an employee has exercised their rights under Section 44. Equally, if they've suffered a detriment because they haven't been paid, then that may result in a successful claim. Compensation is unlimited. Practicality of bringing a claim in COVID-19 times, it's likely to mean that an employee won't get into a hearing for potentially 2 years. Tribunals are already under-resourced. So that means that the employee's compensatory award may be maximised, particularly if they are faced with a challenging job market, which is the case at the moment. So what this means is any successful claims will result in high compensatory awards awarded by an employment tribunal. So perhaps a quicker route to a tribunal hearing is in the form of whistleblowing. Whistleblowing set out in sections 43A to K of the Employment Rights Act. Now, this applies to workers, so employees and workers. And a worker can make an application for an interim relief remedy, which would mean they wouldn't have to wait 2 years to get to a hearing. They potentially could get into a hearing within 7 to 10 days. We've had a couple of these applications in the team a few years ago, and the reality is the tribunals actually dealing with these applications before the respondent has even entered their ET3, the response form. So what it means is when you've got potentially 10 days notice of a hearing, you're having to cram everything in terms of the evidence, gather your documents. So it can put employers in the back foot, and it is designed by claimants to lever settlement terms earlier than expected. Now, whilst there's a high threshold for claimants to succeed with these applications, the reality is if tribunal finds in the claimant's favour that the employer could end up paying potentially up to 2 years loss of earnings before they get to hearing, and there's a final determination of whether the claimant was unfairly dismissed or subjected to a detriment. So whistleblowing, the key components are the worker must make a qualifying disclosure. So a qualifying disclosure is a disclosure of information. So it has to be more than a mere gathering of evidence or a threat of disclosure. It has to be an actual disclosure of information. The employee must also, the worker must also hold a reasonable belief that it relates to one of 6 types of a relevant failure. In relation to COVID-19, it would be breach of health and safety laws for failure to provide a safe system of work. It must also be in the public interest. Now, that's not to say it has to affect a group of people. It can be self-motivating, so it can simply affect one person, the one person that's making the complaint. It must be made to a relevant person. In most cases, that would be the employer. But as David mentioned, there's a public concern at work web form that workers can complete and blow the whistle anonymously. If the worker makes a qualifying disclosure and makes it in the right form, they will obtain protection from dismissal and or detriment against any actions taken by the employer. The burden of proof will be on the employer as well to show that the reason for dismissal or imposing a detriment was not related to the qualifying disclosure. So it's important for employers that when they make these decisions, that they fully document their decision making, the reasons why they have taken the steps that they have. Otherwise, potentially, you could be faced with very tricky cross-examination in a tribunal. Now, something I haven't mentioned is pregnant employees, and pregnant employees may have a group of pregnant women who don't necessarily have underlying medical conditions. An employer needs to consider whether it's appropriate that they return to work, carry out a risk assessment. Now, where it's not possible for someone who's pregnant to work from home, then it's likely to be reasonable for an employer to suspend on grounds of health and safety and to pay the pregnant employee in full. So I'm going to go on to look at suggested response. And Sarah, if you want to just turn over the slide, thank you. So how should you respond to a complaint of health and safety or resistance from an employer worker to come back into the workplace? As Dave said, hopefully you've already conducted your own risk assessment. That's something you can share with the employee. You can consult them on it. You can take them through the government guidance, the 8 sector guides, identify any particular adjustments to the workplace. An employee may say, okay, I appreciate I can come back safely to work within the workplace, but how do I get back to work? I normally use public transport. I just don't feel secure on public transport. Now, whilst public transport may be outside the control of an employer, it is something that they need to factor in within this assessment. And they may need to consider some adjustments. The employee may come up with some adjustments as well. Those adjustments need to be reasonable. So where there is reluctance to return to work because the employee uses public transport, the employer might want to consider adjusting their hours that they travel outside peak times. It might be if they have access to a car, the employer can offer an extra car space. So those are things that just need to be weighed up and properly considered. Any consideration has to be reasonable. I do have a client who has kindly sent Ubers to some of their staff to pick them up. That's not something that I'm sure he won't be willing to do for more than a few weeks because of the significant cost. But I guess that's open to maybe small employers to consider other adjustments they can make. Also, bearing in mind any people with disabilities. So if your employees qualify as a disabled person, then you'll just need to consider adjustments, and you may need to refer the question to occupational health. That could be someone suffering from anxiety. If they have mental health concerns, then actually, whilst they might be anxious about returning to work, they might have a disability that you'll have to make adjustments in relation to. Also address any formal complaints under a grievance or whistleblowing policy. Hopefully you can deal with things informally and you can avoid formal complaints. Formal complaints may suggest that the employer worker is considering a tribunal claim, but you should consult your own policies in relation to that. Ideally, you wouldn't have the same manager who's made the instruction conducting the grievance or the procedure under the whistleblowing policy. It should be an independent senior manager. Possible disciplinary action if the employee unreasonably refuses to return to work. Or potentially, and this really should be a last resort for employers, potentially it could be considered to be misconduct. If an employee refuses to come to work, fails to comply with a reasonable management instruction, but that really has to be the last resort. Employers need to go through the various steps, need to properly assess whether the employee holds that reasonable belief that they are under serious and imminent danger. But it is a potential tool open to employers. You can't keep employees' jobs open for a long time, and that would no doubt cause a detrimental impact on the operations of business. So that's all I want to say on health and safety. I'm going to move on to talk about childcare. Now, an employee can reasonably refuse to come into work if they've got no available childcare. As I'll go on to talk about, the right is rather limited. Now, hopefully, as I speak today and over the next few weeks, employers will have a bit more traction when it comes to dealing with these issues because more schools are opening. I think in Wales, they announced yesterday is going to be the 29th of June. Some more year groups are going back week on week. Some nurseries are opening, childminders are available again. So there might be more facility, I guess, for childcare. But that's not to say that some parents won't be in that position that they simply can't rely on schools. It might be grandparents usually stepped in to help with childcare. Well, that's not possible at the moment. Hopefully that will change over the next few weeks as the restrictions are relaxed. So the rights are rather limited. There's the right to dependence leave, which is section 57A of the Employment Rights Act. So an employee can take action which is necessary to provide assistance to or make arrangements for the provision of care for a dependent, including a child, so that's a child up to the age of 18, who falls ill and or there has been an unexpected disruption or termination of arrangements for the care of a dependent. So this is reasonable time off. So this can range from maybe a few hours to leave on an afternoon to pick a child up through to a few days. So it's in no way a silver bullet it's not a long-term solution to childcare commitments. And also, if a child is not sick, or if there's not been an unexpected disruption or termination in the arrangements, so if a parent has known about this for a while, and you could argue that COVID-19 has been around for a while, so people should have been aware of it, then this may not be helpful to a lot of employees. The other option for employees is statutory parental leave. Now I should say statutory parental leave, you do need 12 months service to exercise your rights under these regulations. Statutory dependence leave is a day one right. Of course, one could transition into the other. Under statutory parental leave, an employee is entitled to take up to 18 weeks per qualifying child per employee. So husband and wife, two parents could take 36 weeks for a qualifying child. However, they can't take more than 4 weeks in respect of that individual child during any year, and also must be in blocks of 1 week. So the right is unfortunately limited. It only applies to employees as well, so it won't apply to workers or anyone who is self-employed. Sarah, if you could just flip to the next slide. Sarah, can you just go back to the slide that starts, there's no legal obligation.
Sorry, that one.
Yes, thanks.
Sorry, I think there was a bit of a technical hitch there. There you go.
Okay, I apologize because we are slightly running over time. So I'll just deal with this very quickly. There's no legal obligation on an employer to pay an employee for their time off. Some employers, of course, will be very generous and will offer some ex gratia pay for employees that simply can't come into work due to childcare and can't work from home. Does an employee have to provide notice to an employer? Not in relation to dependence leave, although the employee does have to set out in writing the reasons for seeking dependence leave and how long it's likely to last. Employees do have to give notice for parental leave, which is 21 days. Also, employers can postpone a request by up to 6 months if it's simply it doesn't suit the business. So if the business is unduly disrupted, then an employer can push back on that. What an employer can't do is and it is unlawful for an employer to deny the leave or to reduce the leave. Okay, so in terms of claims under these regulations, again, we're looking at potential detriment for requesting time off, or if they've been dismissed for taking time off, then that would be automatically unfair. And also, for any employee that is seeking to exercise their rights in maybe year 2 So seeking more than 4 weeks, they have the right to return to the same job in which they were employed prior to that leave, as long as it's not reasonably practicable for the employer, in which case they would be entitled to return to another job which is both suitable and appropriate. It should be no less favourable. Okay, Sarah, if you want to flip to the next slide. I'll mention unlawful discrimination because it's something you should be mindful of dealing with these cases. Any conscious or unconscious discrimination, so for example, where you give some employees time off and not others, potentially may be unlawful based on a protected characteristic. Equally, where an employer implements some working arrangements, whether that be working from home or some form of flexible working, then that may place a specific protected group, for example, women as primary carers. That may place them at a particular disadvantage. Then the employer would have to justify that, so they need to show that it's a proportionate means to achieve a legitimate aim. Also, something that has come up this week, one of my clients, is associative discrimination. So actually, if a parent is looking after a child who is disabled and an employer subjects them to a detriment or dismisses them because they don't return, then potentially that they may qualify for a claim of disability discrimination. So those are some considerations to look out for. So any alternatives? Well, employees do have the right to make a flexible working time request, which I guess is more of a permanent fixture, may not again be appropriate. Employers as well have 8 prescribed reasons to essentially reject any requests. Furlough leave, as mentioned before, 10th of June deadline. Some employers may also want to top up on that, particularly if the employee has exercised the right under some of the regulations. You may be at risk of a claim of discrimination or detriment if you don't top up. So again, that's just something to watch out for. And finally, looking at how to respond to these requests. Interesting, Boris Johnson was asked this question yesterday in his daily briefing about what about parents who simply have no provision for childcare, and Boris Johnson just called on employers to be reasonable. Some employers may have their own parental leave and flexible working policies, which will provide enhanced rights to employees. But ultimately, it's a case of working with the employee. Invite the employee to articulate the problem they face, ask them to set out what alternative arrangements they have considered, what they wish to do and for how long. Of course, we don't know how long we may have to rely on childcare provision. That while some school year groups are going back, and certainly no suggestion in September that schools will revert to a full-time model, then we could be looking at these challenges potentially for the rest of the year. So best to keep an open mind and try to work with the employee where you can. Keep a detailed note of discussions. Important to evidence the fact that you haven't taken steps because the employee has tried to exercise their rights to reasonable time off. Keep under review. This is a moving target. Things change all the time. We may also get some legislation later in the year which is going to help parents more and give them greater protection. Again, as a last resort, misconduct or capability. I think misconduct is the very rare case where an employee is simply abusing their rights. It's unlikely you would dismiss, but also is it practical for an employer to keep a job open for longer than a couple of months? There may be issues around capability. Ultimately, an employer needs to act reasonably, having regard to their size and resources. So larger employers will be scrutinized more than smaller employers when it comes to capability dismissals. So that, I guess, just as a final point, these are unprecedented times. And it is a case, I think, of just trying to work with your staff and listen to them, empathize with them, and hopefully we'll all come out to this together and will be a better world for it. Thank you.
So thank you to all our speakers. I will leave their contact details up on screen now. I will also include these in the follow-up email. As Mark said, we are running over time a little bit this morning, and we have had plenty of questions that have come through. What I would say is that if you do have to leave at any point because you've got other commitments in your diary, we are recording this webinar and we will be sending the link round with the follow-up email later this afternoon. So if you do need to drop out and you've asked a burning question and you really want to make sure that we answer it, we will be recording the webinar, so hopefully you can get the answer a bit later. We did have one question that came to us this morning by email, so I'll start with that one just so I don't forget. And this one is for you, Sally. Because it's about furlough leave. So the question is, I have 3 full-time members of staff currently on furlough since the 1st of April. I'm considering bringing them all back from the 1st of July on part-time combined with furlough, and my queries are as follows. Can I be flexible with the number of days they work each week? For example, 1 week they work 2 days, furlough 3 days, and then the next week they swap that round. The second question is, if when furlough draws to an end and the business requirements don't require all of the staff back on a full-time basis, can we offer them a part-time contract with no notice period for their full-time contract ending? And if we needed to then make anyone redundant, would we need to give their usual notice period? So it's quite a bit there, Sally. Sorry if you want to take that one by one.
Yeah, sure. So question 1, simple answer is yes. If you bring somebody back part-time, it doesn't mean that they have to do the same amount of hours week in, week out. It could be different hours. You just judge your needs from 1 week to the next. Second question, I think if you were planning to offer full-time employees a part-time role as a means of avoiding redundancy, then that's certainly something you could offer to them. The question would be whether they would accept that. If some of them need to work full-time, then obviously that might not be acceptable to them. And if you couldn't get that agreement, then I think you would have to then go forward with a redundancy programme. And yes, you would still need to give notice if redundancies were made.
Okay, fab. Thanks for that, Sally. So we have a question coming out on top that a few people have upvoted for, and it's about self-isolation coming back after holidays. David, this might be one for you, maybe with a little bit of Mark merged in here. But is there a guide on how businesses should or are going to handle self-isolation of employees coming back from holiday?
Not as far as I'm aware at the minute. Obviously, it's just been announced that it starts from next Monday. I know there's a 4-week review period built into that, but still the advice is not to travel. It's to stay at home. So those that are thinking that they may be getting away in the next few weeks, probably not, unless it's absolutely essential that they do travel. But I suspect the guidance when it does land fully will be that if people are being on holiday, they will have to self-isolate. They are going to put measures in as you arrive into the country. So from a safety perspective, it will be self-isolation in line with the government's requirements. From an employment perspective, however, I think that might be one for Mark.
Yeah, Dave, that's my understanding as well. There's no specific guidance on this. Although we had some guidance before lockdown about employees travelling to restricted territories such as Italy or even China. And that, again, talked about a quarantine period of 14 days. Question for employers would be whether the employee can work from home. If they can, great. They can continue to do so. If they can't, then they might consider using additional holiday. Not ideal. If you book a week's holiday to Mallorca and you have to end up taking 4 weeks leave, it's not what anyone wants. Equally, if they can't come in due to the quarantine, then it's likely it would be treated as sickness absence, and they would may only be paid SSP. And I suspect the guidance will address whether employers have to pay SSP in those circumstances.
Great, okay, thank you both. Next question, can you make employees have their temperature taken remotely, i.e. not invasively, when they arrive to work every morning? If they refuse, what is the comeback? So I think probably again for David, maybe?
Okay, yes. Oh, go on,
I can
Sally.
help with this as well, David, because I went to a client meeting 2 weeks ago, and they actually had thermal imaging on the door.
Wow, was it MI5?
They were well ahead of the curve. So presumably if I'd had a temperature, then the door wouldn't have opened.
Ejected, yeah.
But yeah, I think, yes, there is clearly a legitimate reason for doing it. I think it has to be managed properly, and particularly the data protection angle. You need to ensure that the data that arises from that is stored confidentially and is not retained, because there wouldn't appear to be any need to retain it for any period of time. And I think if somebody objected, you'd have to just deal with that. But I think potentially that could be a disciplinary matter unless they had some good reason for objecting. And I'd like to hear one.
Thanks, Sally. We've had a question about using the use of public transport and how we deal with employees refusing to come back due to public transport. I think Mark did touch on that earlier, so hopefully that's answered your question, but feel free to contact us after the webinar if you need more detail on that. Someone has asked, can we bring back a particular department rather than the entire workforce? So they've used a particular example that they would like to bring back customer services as they do not have the ability to transfer calls from home. So Sally, this is a furlough question, if you would like to answer this.
Yes, you can do that. You have to take these decisions, carefully, and you have to have a good business reason for doing what you're doing, but if you're treating people differently. But yeah, certainly that would seem to me to be acceptable. Yeah.
Okay. We have a question about home working. So, is there any advice on home working setups for people? For people working from home for a prolonged period of time, what is best practice and what do we need to do? So, David, I think you answered some of this a little bit earlier, didn't you? So, have you got anything else to add?
Yes, there's lots of resources on the HSE website. So if you just type in homework and HSE, there's a step-by-step guidance of things to consider, such as the mental well-being, as I mentioned in my presentation. But a lot of it's around ergonomics and the type of equipment they may need. Obviously, with tablets being quite frequently used now, so workstation setups can differ. People working at kitchen tables, so it's about people using good ergonomics when at their workstation. So there's a video that talks through on the HSE website that's available on YouTube that you can send to employees and remind them frequently of the need to take regular breaks from their workstation and to work safely.
Great, thanks for the additional detail there. So another one, I think on the furlough scheme, Sally, so is it an expectation for the employer to top up to 80%? Is this a must as part of the scheme?
So it's neither. It's not an expectation. Employers are free to decide what's best for them. I think the government expects employers to top up to 80% once we get into September and October, and the contribution reduces from 70 down to 70 and 60, to top it back up to 80. But no, beyond that, there is no obligation. It's down to an employer's discretion and their financial resources.
Okay, great, thank you. Another question on furlough, Sally, sorry, sticking with you, we'll give you a break in a minute. Does someone need to be on furlough at the 30th of June to be able to use the flexible furlough scheme? Or as long as they've been back on furlough for a full week during the crisis, can you bring them back now part-time and then put them back on furlough in July and use the flexible arrangement so that they can work part-time?
So if they've already been on furlough, then they can be furloughed again at any time up to 31st October. They can't be brought back part-time before the 1st of July.
Fab, thank you for that. We've just got a few questions left that we'll go through. So health and safety questions. So coming over to you, David. Droplets, are there any guidance as to how long they remain on garments, as we have deliveries from all over the world?
Okay, so this one's a bit more difficult. So I mentioned in my presentation, cardboard 24 hours, steel and plastic 72. Now, whilst there's been a number of studies done abroad, and especially in the States, that suggests it could be 24 hours, on the UK government website, the only guidance that they give is when you're considering cleaning, and that you must dispose of your apron, etc. And it doesn't say what type of apron and bag for 72 hours. So there's no government definitive guidance on garments at this stage. In terms of just generally people coming into the workplace, one of the control measures you could consider, and I know this is not a delivery of garments, but what people are wearing, is that people wearing smart casual, normal clothes as opposed to suits that need frequent dry cleaning, as they're able to clean those clothes more frequently. But there's no definitive guidance in the UK on how long the virus lives on garments at this stage.
Okay, great. Thanks, David. Would travelling to work be covered by whistleblowing? So Mark, we'll come over to you, I think, for this answer.
Potentially, yes. So it has to be a disclosure of information. It has to be one of 6 relevant failures. And a relevant failure is a danger to the health and safety of any individual. So actually, potentially it could, although traditional health and safety laws don't actually cover or don't cover transport to work or public transport as within the scope of safe system at work. So it is a difficult one, but I can see potentially a claim could be brought under the whistleblowing provisions.
Okay, great, thanks, Mark. A couple more left. So question on parental leave here. So Sally, I think this one probably again for you. For those on maternity leave or parental leave, but looking to return after July, do employers need to furlough these individuals now while they're on their leave?
Well, I mean, that's quite a complicated issue. I think if they haven't been furloughed before, then it is right that they would lose the right to furlough them once they return from parental or maternity leave, because they wouldn't have been furloughed before. And that goes into whether they can be furloughed whilst on those types of leave, which we need to consider on the individual facts, really, and give more specific advice there.
Okay, fab. So perhaps the person that's asked that question, if they get in touch with you following the webinar, again, probably need a little bit more of a answer for that one based on the circumstances. Okay. And last but not least, if an employee was in their probationary period when they were furloughed, when they return, can their probationary period be extended? Last one for you, Sally.
Yes. So I've had a number of queries along those lines. I think the practical thing to do is to write to employees who are on furlough and during a probationary period to tell them that their probationary period is on hold whilst they're on furlough and will resume when they come back. The alternative is if there's a contractual right to extend the probationary period, then that could be used once they return. But given the duration of the furlough scheme, I think it's probably better just to say to them that the probation period is suspended until they return to work, and then it will run out.
Okay, well that brings us to the end of the open questions. So thank you very much for sending those in to us. As we say, if you have any further questions, please don't hesitate to get in touch with any of the speakers following the webinar today. Again, just a reminder, in the follow-up email, there will be the opportunity to join our mailing list. If you're not already on that, I would really encourage you to join. We have a bulletin that goes out every Friday, so you won't get loads and loads of emails from us, because I'm sure we're all a bit sick of those coming in daily from some places. So we consolidate all of our insights that have been published that week, and we have loads on HR and employment issues into that bulletin that goes out every Friday. We also have a separate HR bulletin that goes out on a monthly basis. The next one is due out on Monday. So please do join that mailing list before tomorrow. I've forgotten what day it is, as most of us will have done, if you'd like to receive that tomorrow. And then just a reminder, we will be sending around the recording of this webinar on that follow-up email. Please do share that with any colleagues that you think this may be of benefit to, or any other contacts that you might have in industry. What we'll also do is we'll upload that to our Kuits YouTube channel, and we'll provide timestamps within the description box, so you can jump to any of the particular segments at the particular time on that recording. So that's it from us. Thank you for joining us again this morning, and we hope to see you at our next webinar in the future. So bye from us.